make a better place for you and for me. Famble them, una good afternoon again, and welcome to the Wel Bodi Tok program, where they come to you live from Radio Maria Salon, the Christian voice. Now you host with me, Gifty Masakoy. They with me for the next 1 hour for Wel Bodi Tok. Now we go begin the program in the name of the Father and of the Son and of the Holy Spirit. Amen. Papa God, we tell you thank you for today. We appreciate you, we glorify you, exalt your name. Continue for pray for listeners and viewers them, and we thank you for all that you don't do for we. Lord, we pray that you go help we for be the seed we go fall in a good soil and we go yield 100-fold. We make all this prayer to Christ our Lord. Amen. In the name of the Father and of the Son and of the Holy Spirit. Amen. Famble. The Wel Bodi Tok program, they come live now Radio Maria Salon, the Christian voice now you host, and they get we live now with 90.9 studios na Freetown, 10 House Streets, na the 4th floor na Santano House, and also 101.3 na Makeni, 91.7 na Bo, and 90.7 inside Kenema. You same way so go connect with this program if you want for make your contributions or make your phone call 0799009007 or 0773151147. Remember say your voice counts, and don't forget for support the radio in cash or in kind. You can call with 4th floor studio or the numbers them where I even call. You can use them for sending you orange money or you are free money, and when you call then go reach out to you. Now inside the program today, they look at menstrual health hygiene, how for help prevent infection, how for reduce odor, and how for stay comfortable during menstruation. And the topic that's today, now me one day, yeah, but viewers and listeners go contribute and go take active part in this program. Today we look at menstrual health hygiene. Menstrual health hygiene. Yes, hygiene for be good. Hygiene they promote well body, and today we look specifically about women them, and we talk about menstrual hygiene. Menses, we commonly can say you period. But before we go better one inside this program, I just want to let you get a reflection as an individual, or if you get your girl picking near you, you go call and let it in near you. When you be start for see you menses, you be don't get information before that, then be don't inform you. Now school, you be get knowledge about that from any adolescent friendly center, or your mama be explain to you, or your big sister, or the one with the menu be able for explain to you before ever that thing they happen. When you be begin for see you menses, now also you be there, or you be there in a public place, and how you be feel like, and how it be turn like, and you be learn from that experience that because that happened, you know, go repeat, so you picking them, you be learn from that day and pass on the knowledge, how it don't be, and almost here you be all where you be start for see you menses, and you they see you menses, how many days it take. You able for tell when you know say you they expect for see you menses, or you don't know at all when you they see you menses na anytime it come, or you know the range. You na person where they keep calendar of your menstrual cycle, or mama you where they listen, you don't they keep track of you picking a menstrual cycle for let you know if you normal or you abnormal, or for let you know if month can we jump am. And you don't observe how they take care of in hygiene. Same way so inside this topic today also we get for look at cultural taboos them. You na family member where girl picking or woman say they on a menses, na time for segregate time, you know, for going to kitchen, or you know, for partaking any other thing, una the sideline now. All that's there inside this 1 hour program where we go discuss and we go learn from. As I say in the beginning, today we look at menstrual health hygiene, how we go help for prevent infection, how we go reduce odor, and same way so how we go stay comfortable during menstruation as if nothing not dey happen, and we dey go about with normal business. Now that's what they look at today. And also young people don't they get challenge, young people don't they get fear. The first time ever we see menses, na be fear for them, na be concern for them, na be surprise for them, because in not don't get the information. And same way so now a challenge for them because you know get what I confide in for talk to now host person say he talk to paddy na school or even the teacher. So let we go small into waiting now this menstruation. I don't say let we get a reflection how it be turn like for you in the first time where you start. Almost here you be old. How many days it come for? Waiting na be you experience. You afraid or you be get concerned, or you be done they long for, or you be done they eager for, and be don't tell you bottom, or you probably be don't tell you bottom, or you don't observe and through film, or you don't read in a book. I don't know waiting are you your experience and how you don't help the young one where they with you, where they care for, how you don't teach them. Because if you not get that knowledge, if they go in for them, and at the end of the day, challenge come with one of the key thing na teenage pregnancy, because some the first time ever where it get an affair with man straight off na other problem. So now as we don't come out from the scenario, members say this now Wel Bodi Tok where they come to you live from Radio Maria Salon, the Christian voice na you host, and me where they bring the program come na Gifty Masakoi. No forget say you can still call and make your contribution na 0799009007 or 0773151147. So inside this program today we gonna wait in a menstruation. We go also try for know if adolescents, young people then prepare for this. We go know also when it can start, then why menstruation, why, then any taboo day misconceptions then they mistake about this menstruation. Waiting at the tips them what we go look at for get a healthy habit during menstruation. Any problem they concerning menstruation, then waiting at the recommendation or waiting at the advice way this program go offer to you all day inside this program. So stay glued to your radio and stay glued, continue for view, and even call other people them for listen and learn, or you can share as well so that as many people can learn, so that we go try for break the taboo for say we not for talk about menstruation. So as woman them, as we they come up, we get stem them where we go physically, where the one who they see outwardly, and same day when are internally. As the picking they grow, the girl picking, same they come, it they get height, they put on weight, they get more fat deposits around in waist, around in bobby, the bobby they come out, they get here and at the pubic areas them, and voice go change. All of them things there, so can be few examples for sure. Say the picking don't they move from one stage to another, and then internally now you get other thing where they go on. And with this physical thing where they happen outside, they pull bobby now, you get pubic hair and all. Parents then get the role for explain to the picking them waiting, then they expect at each and every stage, and waiting at the picking in your role and responsibility. And same way so with the questions the way they come up, you as mama, or you as caregiver, or you as teacher, or you as care provider, you go into a hospital or any adolescent friendly place, you need for explain to them for make them learn, because they get so many questions, get so many fears, so many concerns, so many unanswered questions where they confide in them peer groups, unlike them parents them, or unless other parents them we really don't befriend them, picking them where they can talk at any time. So with this physical development, you don't pull bobby, you don't get the pubic areas them, you don't begin get fine shape, begin pull bobby, voice don't change, and all of them one day. Internally again, other things go they happen. Since the pikin in brain still they develop, yet the brain self so many things they go on there. So you get a gland, a pituitary gland, you get chemical where it produce. And that chemical there, you get the luteinizing hormone and the follicle stimulating hormone. That's why they come and act na the reproductive side. We get different system then at the body. As you dey blow, you get the system responsible. As you dey eat, you get the system responsible. So for let you say you dey see your menses, or for say the pikin get belle, you get system back way responsible. And so for second one day, this luteinizing hormone and follicle stimulating hormone then get role for go play. Waiting at the role. One we know say Motaman then God make we say we for do procreation. So one of the expectation as gal pikin or as woman as the cow they expect where the time reach the right time for make ego conceive and born. But when belle no come, when no do waiting go lead and forget belle, waiting can happen. We get waiting we can say normally we get cry of the disappointed uterus. So this luteinizing hormone and follicle stimulating hormone gets a role for can play na the ovary, and the ovary get boku egg them, try for CCA1, go try for anyway, go if sex take place, then definitely that sperm they try for come for fertilize that egg day. Now the fallopian tube, and later it go settle at the uterus. But if for any reason that's not ever happen, waiting go take place. The uterus normally we call and say na the host way they prepare well for stranger. He always expectant, he always want stranger for come, and waiting at that stranger day. Now where fertilization don't take place na the fallopian tube, they can embed na the uterus, and then they for 9 months, or at most some people the uterus or the bombli, as I can say, the bombli can host this stranger maybe for the next 10 months or 9 months, or some before 9 months if not preterm. So if belle take place, fine. But if belle not take place, you get cry of the disappointed uterus. The uterus they cry, say, hey, with all this bed where I don't make, with all these preparations then where I don't make, still nothing not happen. So waiting they happen, it is shed. And because it is shed, because it don't hold you, it don't make the bone blind fine, it don't prepare and well, it don't nourish and when enough blood supply and everything. But at the end of the day, what they expect not happen. So because of what they expect not happen, the body no need them, so they come out, they shed them out. So the uterus they cry. So that come with menstruation, and when they come, you expect them for flow easily, and that can start in gal picking them. Some as early as 9, 10, but others now in the teenage from 13 to 17. Some it can start very early, some it can start very late because of everybody make up different, or because of certain other medical issues them. Maybe you get some contributing factors them. So we look at the normal. So if this bikini also don't start, so we take and say the menstruation and the shedding of the lining of the uterus were accompanied by bleeding. Just as I say, the bone blind, it don't wait for the stranger till the stranger not come. And so because the stranger not come, they don't get the message say the stranger not they come, and time don't pass from the stranger come. So the best thing now for undo always be don't prepare the bed we be make now, the food we be cook now, everything. So it's like that. So that undo they undo everything now, they come in the form of that menstruation. And this one for come every month except for menarche and menopause, the one that we just start for see the menses, or the one that we did towards the end for left for see the menses. It can be irregular. Sometimes it will take a longer time before it come. Other studies go say menstruation will come once every 28 days when an average, whereas in other people then maybe now once every 21 days, we can be the shortest cycle, and other people them it can dey up to 35 days before then see am. And likewise also, some people then can get a very short span of the menstrual cycle. Some it can come for 2 days, some up to 7 days. So it depends. I don't know how long you own, whether na 2 days, na 3 days, and all of them thing in it. So we dey look at this one for make we able for understand better one the topic we dey look at today, when na menstrual health hygiene, how we for prevent infection, how we for try for reduce the odor, and how for be comfortable during menstruation. Now for sake of that, make I don't talk first waiting na the menstruation, waiting responsible, the hormones them, the luteinizing and the follicle stimulating where they come, and also the estrogen and progesterone test get for the wearing, get for prepare the uterus fine one for let the stranger come. But when the stranger no come, then you get cry of the disappointed uterus, where they lead into menstruation, where they come once every 28 days, and you count the first day as the beginning of the menstrual cycle, because you get phases in the menstrual cycle, and then phases, then there you get the one before the egg release, where now the follicular phase. You get the one where the egg don release, when at the ovulatory phase, where then the most of the time when they take note of and say, oh, it's like at the ovulate, so they begin get some person go say, this me one side to me belly, down side they at, or I they feel me body they warm too much, or me vagina discharge, they can if you buy like a raw egg, the white one, all of them one and day. Then you get the phase when after the egg don release, when the luteal phase. So you get all of them phases there where they take place. We get estrogen, we get progesterone, we get follicle stimulating hormone, we get the luteinizing hormone, where all they play their own role. And so why are they going to all this now? For there we go understand better one into waiting we they look at. And then now we look now if the adolescents then prepare for this. With all waiting I don't say the adolescents then prepare for this. Girl picky way don't they come up, they prepare for this. Mama don't tell them, auntie don't tell them, teacher don't tell them, big sister or big brother don't tell them, because it's a myth that the man then thinks they no need for talk them. Though I know say with exceptions, there are few men we still take the motherly role for able for do all of these, for follow up them, picking them and all. Then when it can start, as I say, it get menarche, and also how long it can day. Some person in the day from 2 days to 7 days, and I think where they start from menarche until menopause. Other studies they say when you consider the length of days or the length of time throughout the woman in existence before you reach menopause, then consider and say it take up to 7 years. 7 years in a sense, accumulating all the number of days where the woman be done they see in menses, then consider and for be that long. So at the end of each menstrual cycle, you'd expect say the woman need for build up and try for fit again. So it starts as early as some man 8 woman girl picking 8 years, 9 years, some 10, 13 and all. Some it can be late, some it can start very early in the age. So with all the challenges there, if you say you begin start very early or start very late, now concern for you, then you need for go see the doctor for expert advice. Then why menstruation? I don't already explained earlier on in my introduction. Menstruation they take place because it is shared waiting if you don't prepare, it is shed the lining of the uterus, it is shed them where they be followed by bleeding, because you don't prepare and they expect say belle go take place, they expect say fertilization will take place, and the zygote take turn to waiting for turn the embryo and all the planting, and the fetus stay we see say we get a live healthy baby, the mama born and all. But if at the end of the day where the uterus so expectant, then it not happen, then waiting come after na menstruation, when at the shedding of the endometrial lining at the uterus, where we normally go say disappointed uterus, they cry. So it can take 2 to 7 days. It can be as short, it can be as long. It depends. I don't know, your makeup. And same way, so it can come maybe once every 28 days in most people average. Others as short as 18 or 20 to 21 days. Others as long as 35 days. Maybe we're seeing menses today, maybe it can take after 35 days back or 34 to 5 days before you see. So all of that one day you get for keep track of them. Family members say now Wel Bodi Tok program, they come to you live from Radio Maria Salon, the Christian voice. Now you host with me, Gifty Masakoy. If you just they join the program, members say today we they talk about menstrual health hygiene, how we for help for prevent infection, how we go reduce odor, and how we go stay comfortable during menstruation. We not for be any hamburg or any problem where somebody go pick on you, say now so and so and so and so and so. So the lines they're open for call. I be don't give a reflection. How it be start with you. Waiting I be the challenge. People be there way explain to you. Parent and be there for you support, or you teacher or community member, or it just come as a surprise. You be there in fear, or you be get too much concern, or how it be look like. So all of this. So we don't look at waiting a menstruation. We don't know when it start, and also we don't know why menstruation, because belle not take place, then you get shedding of the uterus. Then let we look at taboos, misconceptions, and myths, different beliefs, different things. You go get your own explanation there. Some person go say, when they see menses, enough for go na kitchen, enough for cook, enough for prepare food. Others go say whether it's religion or whether not the family or whether not just the makeup. So many taboos around it, or because of menses, enough for go school, or enough for the in public setting, and all of them one day. So we get in cultures there, we get in taboos them, others then are myths. We challenging ways we go say don't sideline the girl child, because if you say the girl child in menstrual cycle if for sit on a house, you get exams for perform, or you got some other thing them, then now a challenge. Then you they segregate them more, then you they sideline them more, then if not possible needing privacy, then there is no more privacy, because the mere fact you take that act, the mere fact you take that decision, then you don't sell out, or you don't already make people know what's the problem. And it's something that is natural, that happens to every woman. Every woman, they see menses, except other reasons. But every woman, they see menses, and once every month, every 28 days, or as long as every 35 days or 32 days. It depends how long you own kinde. Then they talk about the taboos and misconceptions. So most of the time as well, if the male child like one gives support, or it meets the mama and the girl picking they talk, it's like enough for there, and which of course the male child in the future get for care for a family in the future. In the office he get forget woman and the way they work, and issues like that will come up. So I for say we not for look at that one day for say the male child for be exempted for know about waiting, because mostly when just like normally some man them can decide say if a woman they into labor, if they gonna the labor room, right, and the woman choose who I wish. So if you say na husband for the day, get for the day. And definitely we've seen scenarios wherein the man observe and see the progress of labor from the first stage to the end, then he actually know what he mean, why that word labor na real work na the woman go do na the labor word. So he go get extra respect for the woman, extra passion or extra concern, or no say na especially when I primary in first time for boys, see the long hours way they take. So it's the same. girl picking, they go through dancing there, or even at school, then they teach sexual reproductive health. Enough for be exemption for say the male child, not for the other male child, not for listening, or this or that one day, or the girl picking because it on a menses, enough for go church, enough for go na kitchen, enough for lead on a bed. All of the things that they enough for lead on a bed. So many things. So like you mentally they torture the girl child. Mentally you they torture them, because is it that waiting they happen to me na me fault or na me go buy am? No, it's natural. It's natural. And you get plenty girl picking and or woman themselves where they pray let the month reach, let them see the menses. Unfortunately, it not happen because of one reason or the other, or because maybe their contraception don't fail them and all of them things. So it's something natural. It come. And you therefore prepare them mentally for me they accept that this is natural way they happen. It is send signal for say pregnancy not take place, and so the disappointed uterus they cry and make menstruation and go last for few days. After that you are up to the task again. You can still go with your normal things, but just that you need extra care, extra concern in line with you genital hygiene, because you need for present yourself well. You don't need for this on side and get the smell and begin think they turn it so and all of them one, and they just like that. So these are some of the taboos. So we go to the tips for healthy habits during menstruation. We get some tips. So you will just they join in. Remember, say this is our Wel Bodi Tok program. They come to you live from Radio Maria Salon, the Christian voice now you host with me, Gifty Masakoy. Today we look at menstrual health hygiene and how we go help for prevent infection, how we go reduce odor, and how we go stay comfortable during menstruation. But for let we understand that one day better, I don't go into waiting a menstruation and how it happen and when it start, and also I give scenarios for the people let woman they reflect how them be done they do, whether they be in the known for see them first menses, or I be a surprise to them, I be a concern to them, I be a challenge to them. Then parents they not be ever tell them anything, or the school not ever tell them anything, or even when they experience and come now host how it be turn like how the reception be there, because all of this mentally they affect the girl child. And if we they say well body according to World Health Organization, it's in a state of complete physical, mental, social and spiritual well-being, not merely the absence of disease or infirmity. So if mentally you don't touch other picking day, then in well body one will be a challenge. If you get unanswered questions, then na a challenge for them. If you go school but because of menses he reserved in a house, then a challenge for them. A miss classes, all of them one in day, or they look day aside when it comes to activities, sporting activities, so many other activities it keep preserved because of misconception, taboos, and some other kind nabating them. So we continue for say menstruation. Also we call them period. Now a normal, underline the word normal, a normal. So it is part of every woman until it reach menopause. A normal. So now a normal process where they start from menarche to menopause. So from the first time where they see menses, stay right through you born, say the day where you they stop the journey where you start. So we normally can call them period, and a biological process where they experience by girl picking them or by woman them all over the world. And also now a period when the uterus now in the bone blind where the woman get belly, the uterus where they call the womb also, and they the picking get for the the term reach for le is a attire for the usa de la common now. So the uterus they share the blood and the tissue from in lining, and it is left through the vagina approximately 2 to 7 days. So as I say, some people it can be very short, others it can be very long. So woman can see menses. Why they say man so woman they see menses up to 7 days. So we get all of these way they go on. Except, as I say, except before it start for seeing menses or after menopause. And same way, so some people get for stop for see the menses during pregnancy where belle don't take place. Ideally, you know, go see menses, except some other underlying issues, but enough for seeing menses. Then same way, so if they breastfeed, you get a condition where we look at if woman they breastfeed continuously, it get lactational amenorrhea, because they breastfeed, it definitely the day you know they see in menses, it can occur in some women them. So you get that one day. Then also as I say, in the menopause, and also if you get some medical conditions, then all of them one day also can be a cause for a stop for see in menses. So when it occur, the menstrual cycle now a hormonal process. I don't talk just now in the introduction, but the luteinizing hormone, the follicle stimulating hormone, the estrogen, the progesterone, where they all get their own role for play. As you see the girl picking, they go, they pull bobby, they pull fine shape, and all of these, the ovary self they under, they ready for release egg. All then thing they already come up from the pituitary gland and the brain gets in your role for play. And it expected belle for take place. But because belle not take place, this uterus or this womb or this bombli, we don't really prepare for this belle, it not take place. It don't be a disappointed uterus. So it is shed, it is cry. So menses, it can last 2 to 7 days. It depends how many days it can last for. So normally regular menstrual periods in the year they between puberty and menopause, and usually now a sign say your body they work normally. You they see you menses, not to belly you get, not to bobby you they give, you know don't stop menopause it, you still there in that age. They tell you say in your reproductive area you normal. So good menstrual health and hygiene practice, it prevent so many problems. As we say, we want for prevent infection, we want for reduce odors, we want for help you stay comfortable during your periods or during your menstruation. So now let we look at some of the tips then we for look at some of the tips. The tips then where we go look at one, hand washing. If we want for prevent infection, if we want for reduce odor, if we want for be comfortable all the time, do you normal things then. One, hand washing for be part of you before and after you change your pad, or I don't know which one would you use. Some people, mostly in Sierra Leone, we get the sanitary pads, tampons. So it depends, but sanitary pad most common. So you want change your sanitary pad, you wash your hand. After you don't change again, you wash your hand. Then also you for discard, you for throw away and properly. You know go even na flush toilet, it go cause problem. So if you know get pit latrine, you can get different small plastic them where for any change you know say you dey tie and then you go dispose of and well, rather than you just throw away at any side. Like how you can see then can just dispose of pampers na streets, then wherein they come there you go just see that pampers they swell and all of them and they die indiscriminate dumping day. We need for stop them. So if only one for prevent infection, we need for the wash we hands before and after we change we sanitary pads. Then also how we they dispose of, and we get for be very mindful how for take care for dispose of this. Other person no need for siam, so you get for take very good care of them. Then we not for flush them products they are down the toilet. Then you for change your sanitary pads every few hours. So it depends if you're not that person where they see you menses that long, or they can't too much. You know, say they wait 3-4 hours. You within yourself, you know the kind way how it can, especially the first second day it can that much. So you know say you get for they do frequent changes. So if people you they come out for long hours, you know say you forget extra na you bag where you go able for go na the closet and try for change and keep yourself tidy, wash your hand before and after. Then also you need for take care of your underwear them. You know, use one underwear from this morning till evening. So if you like you change the sanitary pad, then the same pants they then also back you use nylon pants. So nylon they accommodate more heat and it's so favorable for infection. So you get for avoid that one day. Then also you most people can prefer for use dark color pants them. And also, you know, say as I say the first 2 days, some other people say maybe you can say the sanitary pad for them very small or very light. So some can even prefer for use pampers where they can even cut and because it go absorb more. So it depends what you think say you for use. But remember, hygiene come first, and also how for dispose of them, and also for wear lightweight breathable clothing. Not use thing way very tight and then at the end of the day you yourself they feel uncomfortable. So we need for avoiding tight thing and so that the heat not go allow jams them, because the tumbu themselves go enjoy for survive na that side. Then also we for keep we genital area clean, as I say, you get for wash. Then tell we say we don't need for use soap, we not use for use any scented soap, just use plain water. And also if you attend yourself to the toilet, you need for clean from front to back, not to from back to front, because whatever you go pull from the back and carry it in front you, they cause more harm than good. So from front to back. Then with all that go able help we for prevent yeast infection or bacteria vaginosis. So some of them infections they wake and woman and they scratch they get discharges and all. It can be say it arise from the poor hygiene during your menses. You know they change your pad regularly, you know they change your pants regularly, you know they wash hands, and maybe you they clean yourself now from back to front, way for be from front to back, all of them things there. So then also for avoid, as I don't say earlier on, let's avoid for use scented soap. Then also try for drink plenty, take plenty water, because as you they drink it they help you for wet. As you drink it they help you for wet. So they even wash out the urinary tract and they help to prevent infection like vaginal candidiasis. So drink plenty water, befriend water. Then also you for track and monitor your period, or track and monitor your menses. As I say, get a calendar. Some people, some woman there or girl picking not even know when are in next the range. We say at average every 28 days, but some person can go as far as over 30 days, others before 28 days. But get a range, and if you don't keep a track for 6 months, you can even easily know the range when you will see your menses and how long. You don't know say now every 5 days, every 4 days. So you they prepare ahead of time. You know wait until the stranger come, because for any time where stranger they come, it don't already notify you for say they come. So you not go wait until the stranger come, then you go begin defend. Hey, but when I get tissue, when I give me no, then that person just pull in tissue in bag again. No, I be don't keep an in bag. Then you go insert her. At the end of the day, now room for infection. So you know say every month you get for see menses. You know say you don't pass 2 weeks, 3 weeks. So the 4th week now they expect. So you for always stay handy. Forget your sanitary pad along with you, and also so woman can be mindful even the color clothes we go put on, that no I need for put dark clothes so and so, or within yourself you they begin get even some body language. Some person go say in body, my body look one pass all the other days there, or my body look heavy, or I don't get pimple. Some people don't be specific, they know when the signs are there. Others they get mood swing, they get mood changes. Some now they feel for it and all of this. Then during the menses or the menstrual cycle itself, some man go get cramping and pain. Some go get fatigue, you tire, you just get that mood swing and all of this. So no two people are the same. All man gets iron. So we need for track, for let you know your regular marker for your overall health, and you also need, if you no one put on a calendar na the wall, or you no one write in a book, you can easily get the app na your phone. So I can mostly tell people, say your phone get more work for do for you than just TikTok or Facebook or WhatsApp. You get so many other things the way they help you with. So you can easily get the app for download them, or you even go na a gallery, you know, say it did the cycle, some can say cycle bead or different one where you go download. And when you main sister, just click on them, then you know say it go give you a range. So like now how many 1-2 years once you still use that phone, they keep a track of when I be your longest time and all of these, then you actually know what you said. So with the tips, hand washing before and after, frequent changing of the sanitary pads, the pants not for tights, you get for change frequently, get for wash the genital areas frequently, you not get for use too much tights in them, because the bacteria or the tumbu themselves, they get opportunity for grow and infection. Then members say where mostly woman they get infection, as I can say, as they get infection, they go up ascending, especially when you begin take medicine, you know, don't. So you just they tell the medicine, say, okay, you know me party, you go. So I made a don't studies don't prove, say in by 2030 or 2050, will they get antimicrobial resistance. Them medicines them say, hey, after me medicines, I just take 2 ampiclox, 2 this, 2 that, and they're not get for a walk again, because we don't misuse them. So drink plenty water, change your sanitary pad frequently. If you know say you first 2 days it become very heavy, if na pampers, if you say you want for buy, you cut them into how comfortable you want use, is left with you. If na the pad, you know say na 2 packets you get for use for every month, you try and get them and they let it be handy. So all of these, then within yourself, for you they actually get you smell and not say no, I'm not okay with this smell, not supposing need for tell you that you need for change as frequently as possible and drink more water, and so you go able for wet. But also, if you get challenges, them it can too much than I before calm, or you know can the way are you they expect them for calm, or you they get some smell where you know okay with, and with all then advice there what we don't gain are just the same thing you they expect, you they experience some things that way not they tell well on you, then you need for visits your healthcare provider. You need for visitor. And also it advisable for the way they do annual checks. I don't talk and plenty time na radio say the best gift ever where you they give yourself. Now for say me birthday, la go do checks, la go do medical check. How are they do? La go check me eye okay, or I need glasses, or the glasses why they use they need for change them, then go tell you. La go check me teeth, then go tell you how many. When they scan and then that's how you gonna say you get many teeth we get problem where you not see them, but the scannable pick up. Then so with reproductive health, every year it's advisable that we go do checks for med and check with Bobby for see no lump no day, or they not made a detect if they get signs of cancer. Then can go do your pap smear, then also can do your pelvic examination. All of the examinations there. So the need for one, you need for one once a year, so you can give yourself as birthday gift that a need for go check, not wait until water pass flower. So do you well woman check, do you pap smear, do you pelvic exam, where then go check all your organs the way responsible but born picking business, and then you do your breast examination, because all of them are so then very good for you reproductive health. The thing the way responsible, the ovaries, the uterus, fallopian tubes, the cervix, the vagina, all of them when they are where they play a role, they need for well. So if only you do this one there, then go able for pick up and detect early if cancer one come or whatever, then go able for pick them up early, and then you'll be prevented. So anything where you experience, try, you get change in odor with all the extreme care where you don't take, you they get more severe period pain, than usual, or you dey get heavy flow than usual, or the pikin tell you that one day, because most of the big one then go most on. But they emphasize for the adolescents, the one that we still they go school, where they in the JSS, the SSS, because most of the time we don't see they don't let for go school because the belly at them too much, or them feel this way or them feel that way. They don't miss papers, there is nobody talking to them, so they are mentally disturbed. So all of these now a challenge. So as I say, always get a sanitary pad handy when the time they come close. Avoid bright colors, or you also try for double up. You use dark colors. It can embarrassing, especially maybe not to even woman. Sometimes a man self tell you say, sister, turn back, look you close back. It can embarrassing. So mostly for the big one, I go say we the guy told her what you say. But that's in a negligence or waiting. So you need for nobody safe. Mostly I can tell people say the woman them can fail for nobody themselves more than allow the man them for no more body than out them for nobody themselves. You need to know about yourself. Tina before glass and she says, as they say me face they change you, as she say this part they change for me, I need na concern. Let her go do this, let her go do that. No wait until the problem was. As you begin to observe something, seek advice. Not go over the counter just to go buy medicine. Yeah. So if I forget tips, those are the few tips. The few tips where I go give, where go help for prevent infection, where go help for reduce odor, and same way so where go make you feel comfortable or stay comfortable wherever where you find yourself. Then we look at the problems. Waiting are some of the problems them. I don't start them earlier on. Some of the problems them. One from the family, their parents, them, the mama. Mostly in we own setting, we expect the mama or the big sister or the female for explain to the teenager where they come up that you go get for expect this, you bobby go get for come out, you shape go get for begin change, your voice you go get for get ear and yondan and other side them, and at this care you for take, you get for use shaving stick, you get for this, you get for dandy, and them get for calm, you go begin for see you menses what we call period. You go count every month where sometimes go last 2 to 7 days. It depends how many days. With that one it can make some person uncomfortable, some person belle go out. You don't begin prepare in mind, just as the uterus don't they prepare as a stranger they can. So instead begin prepare the pikin in mind, so you know cause fear, you know go cause shock, you know go cause surprise to them. So one of the problem is the adolescents them not get confidence for talk about them because the parent them look enclosed, they not open up, or the parents seem to be too busy. Then they face stigma, or it can be harassment at some schools there, or some family or some communities, and also they can consider forget social exclusion. Then they see men's like they and not they encourage them for kanaya and all of that one, and because they're ignorant also they don't tell them, that can lead them to unwanted pregnancies. So you go just say, well, you don't begin see menses as you church man so na belle. No, it's not that. So the beginning go just say, not church me oh. But when you tell them the right thing, as you don't begin see you menses, na signal for say you get sexual intercourse with man, you go get belle. So straight off he go begin ask you more questions and be open up and ready for answer. Then we get discriminating social norms. We get some norms them as I don't say, I know you na girl picking, no you the mess, no go na that kitchen, no do this, no do that one day. They will get some cultural taboos, poverty, lack of basic services. Some person it can be a challenge for them because toilets not the area not the way get enough water. So wherever it happen, if na school it happen, they go tell say, hey, go now. Also imagine however I don't mess up himself. They say go now. So it get for begin feel how it go look after himself till he reach now home. So all of these are challenges where mentally they hamburg, and so we need for pay attention. And also the sanitary products them also it can be expensive. Maybe some parents not waiting, others go decide say, well, because you no able buy the sanitary pad, then definitely the pikin go use cloth. However, if you think say na cloth you want for use, then ensure say you get for wash am very very well, and you get for sun am let it dry very well, and maybe you get for put an aside way secure way other people no see. So but now consider as in a big compound, so there is no secrecy, there is no privacy, so the pikin go begin feel some kind of way. So all of these are challenges where we need for look into. And during the menses also, they can get restricted mobility, they shy away, say no waka something, but they even affect their attendance, I don't say earlier on, and even in participation in some other activities then. So some also the sanitary pad, so because you dey keep them for too long, you go begin for itch, you begin get irritation, you begin get some smell. So now that means they say forget frequent changing of, and not begin one say hey, this is there. So you go begin get smell where you know okay with, then you go begin to scratch, or some go even go pull rash, because just like where you make pampers stay and picking, I they react now the same like that one day. So some also, as I say earlier on, can get a that some can get either in appetite increase or you know feel for it, some they get cramping and it tell say me belly, or all of them one they begin then you need for explain to them, because the uterus don't expect this stranger, you know, can instead they try that already be don't prepare like come out. So that squeeze where they squeeze for let shed the blood out, all that one they cause that problem there. So during this time I get for tell and time way for use full pants, you know, use need for use G-string and all of them one day, because you are causing one. So all of these small things there, so it count. Then we go now to the recommendation. As I say earlier on, always talk to your doctor if you experience a change in odor and any other thing. So we look at the recommendation quickly. The recommendations here now that one, we need for spread awareness now with community, just as we don't listen, try for educate others. Now the school, the church, the areas, them all we find we say about the importance of good menstrual hygiene habits. Good menstrual hygiene habit, frequent changing of the sanitary pads, for take care of them, for dispose of them. Either you burn them, turn a plastic and dispose of them well. And also the adolescents picking them for try for meds, they able get area way friendly where then go there and they talk to themselves. We also need for prevent environmental pollution, so areas then for be created as schools and all others. Then also during the menses, so some can feel pain and some other things. So just do certain way they take your mind off and do you normal. You can do a brisk walk, you can pause and take deep breath, and you can apply it. Maybe you take towel, soak out with hot water, you tie them, you know, for you squeeze them. Then at least you lay at the lower abdomen. All of this can able for help. Then if you feel say now rest, you need to take plenty fluid and rest. Then if you think say then they tell you say no, you don't have bed because of your menses. Then parents say when I need for support, they're not saying that it's no longer hours, so they need for double up the sanitary pads them. Then of course you know you go avoid using brighter bed linen. Maybe you can use alternate something like other lapa for layam, so you go sleep and or just make them feel comfortable, mentally stable, so you go able for waiting. Then also we need for give social support. Parent they need for give social support. You go don't know say you picking na so number of days, and when it can happen, you know they greet or they feel moody, they this, they down, and they already know. So you need for give support. Even teachers na school, you need for give support. No need for begin say and are you angry if you don't start with na so there are times we words the more we can talk to them, it can be more annoying and more painful, so it can better we either keep quiet rather than we say things we go cause more pain for them. So we need for give them social support, and we also need for give them the knowledge and skills. Parents, teachers, all other people where they play that role, the adolescents friendly places, them even the boys, they need for give their own support, we for demonstrate how for use and dispose of them, and also we for adapt to the healthy practice, hand washing before and after, how for dispose of them, the frequent changing, even get you on odor and not say I'm not okay with it, and all of these. Then the facilities them for be available. the offices them forget enough water, some person go and go change himself and all of them one, and then we forget access to them materials then also and supportive supplies. Of course, some schools I know say don't they get free sanitary pads and all, but others still get for buy because maybe the number of days and all other things. And if now washable things, then you get for wash them well, you get for iron them well. And no saying a blood, if you not wash them well, it gets some smell way look ranky, so you get for do all of them thing there. So and also having readiness for your next menses, something way handy in your bag when you they come out. So family them today we don't talk about menstrual health hygiene, how we for help for prevent infection, how we for reduce odor, and same way so how we for feel safe and comfortable wherever we find we safe. We need for wash we hands, we need for put on pads and change frequently, we need for put on cotton pants, we need for be comfortable, drink plenty water, we need for get brisk walk, exercise, rest. If you get any mild challenges like headache, abdominal pain and all, you're advisable to take plenty water. You can do soak towel now hot water, squeeze them, that heats they small let it lukewarm, and then you do that one. But if you see any of them problems there, you menstrual cycle, the smell, you know, okay with them, it become more than expected, and some other things that we know okay with it, they feel abnormal pain and some other things, you need for go see the Well Bodi Workman. This now Wel Bodi Tok, we come to you live from Radio Maria Salon, the Christian voice. Now you host with me, Gifty Massakoy. Remember, say this program they come live every Sunday 4 to 5 Santem. So fumble them at the left one now. Let una help for share and also teach and get time with you girl picking, listen to them, and also you as the big one, not forget for do you well woman check. Every year, give yourself a birthday gift or anytime for go and check yourself and see say you okay. Because when you they see you menses, tell you say your reproductive health safe now one sign where you say something good. And also it come every month, once every 28 days, or as long as every 32 or 35 days in some people, and it can come 2 to 7 days, shorter or longer in some people. And you need for abide by the rules for prevent infection, for cut down on the odor, and also try for be comfortable, and also give the mental support to the young picking them where they come up, that they accept them as something normal and move on. I left una now in the name of the Father and of the Son and of the Holy Spirit. Amen.